Okay, we'll start by working the towels, yeah? Very, very important. So normal, you do the same T towel. Remember, the upper towel is alongside the body, and that was down, so it has the letter T. And then when you do the upper body, you can just take the towel this way, yeah, massage, that, continue. Now you want to work on the lower body, so we start with the lower back, yeah? Okay, so Mark will have to look on the other direction, and then we will probe that. Good. So in this position, you could start. Oops, sorry. You could start first by doing traction. You can hold on to the lower hip, and then traction. Is it? Do you feel the Do you feel the stretch?
Yeah.
Okay. You can do that as well to the two sides, but that side can't move because it's on. Do you see how nice the sideline technique when it comes to stretches? You know, it's very nice. And I just want to show you another one that is really, really nice and cool to do. That's taking the leg, the upper leg. And now, you don't lift it, but you drop it, and then you're stretching it this way. You can actually do kind of oscillation and stretches. Do you feel that, Mark?
Yeah.
Yeah? Where do you feel it?
I would say lower back.
Okay. So they should feel the stretching here. Yeah? Yeah? So it's quite nice to do. You can bend the knee back, put that. And now I'll continue working onto that area. So first of all, again, oscillation. Yeah. Now, if you have an area, I'm not suggesting that you will do, but because now inflammation, acute inflammation is contraindication for you. But later on, you get more experience, maybe you do a bit more courses, you can start working on area with acute inflammation. And one technique to do is to oscillate that area. And what it does, if the area has full of fluid and inflammation, oscillation reduces the fluidity, drain that area, and by then you decrease the inflammation. Yeah? So you're not pressing hard, but you're working to oscillate, to increase the fluid dynamics, the fluid movement around. The pain and inflammation, a lot of it is because there is an increased fluidity around that. It becomes swell, red, hot, angry, painful, and to reduce it, you can start move it. Movement, squeeze the fluid, and help it to be drained away from that area. Yeah. So light oscillation, a bit of stretch, and you can go further if it's any better. Quite simple. Okay. Then, when it's getting to be milder, you can start working deeper. I like to come from the opposite side and work on the lower ribs and the rectus spinae. So the rectus spinae is there. I'm coming from the outside and look this way. I'll show you from this direction so you could see. So quite a lot of bending. Next one, of course you can do the effleurage, petrissage, really nice in freedom. Could you come closer now? Also, if you can come to the other side. What I want to do now, I want to create a situation of laxity to the erectus spinae muscle. So imagine that this is the muscle. What I want to do is do that and back. This one and back. And how do I do that? By taking the hip upward. Yeah, I'm taking the hip upward. Do you see how the muscle is a bit lax? Back, bit lax. Can you see it? Yeah. Now, with the other hand, you're just helping. So you're doing that with both hands. Especially the thumbs goes in here. Yeah? So what you cannot see that I have a both effect of both hands pushing down. This hand push down so that muscle allow the other hand to go deeper in. Same thing. Now, not with the thumb, but the base of the wrist. Find a rhythm sometimes and move it. Good. And then, after a while, in a way, when you find the rhythm, you let the body to work for you. You don't have to put so much energy, it's just bouncing it. So that's the bounce. Or you can do then the bounce opposite of stretching. Now what's the benefit of it is that you work in deeper muscles you can't really reach. Any stretch does that. It's impossible to work so deep without moving. Here I let the movement does the job for me. Okay. Few more techniques that I like doing. One is the quadratus lumbarum. Yeah, you are palpating the rectus spinae, and then go a little bit forward. You still feel a muscle, and then you go a little bit further forward, and actually I feel a bit of a stomach there. There was no muscle, so I went too forward. I need to go backward a little bit. And the first muscle that I feel is the quadratus lumbarum. Is it tender, Mark? Yeah. Once I feel that, then I can do the same. I can lax it. Hip. I can come from the opposite side, from here. Yeah. This is now erectus spinae. Now I'm on the vertebrae. Yeah. Moving a little bit. Okay. Next is covering that and start working on, can I go take it a little bit down? Work on the gluteal muscle. So coming from the front, I feel the bone here. You can feel a little bit of the tensor fasciae latae, which is a really small muscle that tends the fascia. That's the name of it, tensor fasciae latae. So it tends the fascia. The fascia is the iliotibial band. It's relatively small and it's quite forward. Check it and see.
It's a pretty tender spot, isn't it?
It could be quite tender. Yeah. Then gluteus medius. The gluteus minimus, you might have an indirect effect under gluteus medius. You will. So you can do that a bit deeper. Maybe even go with your forearms and very slowly sink. Just look at the eyes to see that they are okay. Get some feedback from them. Yeah. Gluteus maximus. Yeah. And go actually not only to the edge of the sacrum, but go on the sacrum itself. On the sacrum itself. It's quite bizarre because you will massage bones. Yeah? Why? What happened is that all the erector spinae muscle and the quadratus lumbarum and the thoracolumbar fascia, there are a lot of other stuff that attach to the hip bone and to the sacrum. And working on the sacrum itself, you still have a little bit of muscles there and a lot of ligament and tendons. So it has a wonderful effect sometimes on the lower back. Sometimes it would have no effect. But sometimes working there and you feel stringiness there, like chord of guitar, yeah? Work on that, and sometimes they will tell you, oh, that feels great, even if you work a lot here. If you start working on the sacrum, it has an add-on, not all the time. Yeah, just try that. Put it in your protocol of trying things. Yeah, how is that?
Good.
Is it effective or?
Yeah.
Okay. Okay. Of course, you can come and do the other technique, oscillation. If you have client that you're not feeling comfortable, don't worry, do it on the towel. Yeah. However, if you do want to work under the towel, then you do that different draping. You're taking the top towel, the bottom towel, and then you can you lift your top leg, lift your leg just all the way, yeah? Thank you, good, that's it, good. So you actually create kind of a cradle with those, and all you do then is just arranging it this way. And you can ask them, or you can just leave it here, and it's all nice and ready for work. Iliotibial band, the best thing is to come from the opposite side, and you need to start slowly. A bit tender.
It is a bit, but
If it's getting to be quite tender quite quickly, warm it. You can do quite a quick movement in there. Sometimes it will be as tight as you feeling like a separate connective tissue. On that night is not too bad, so you would not. But sometimes it will be like clunk, going over a ridge. Yeah? That indicator really that they really need it. So that iliotibial band attached below the knee. So it's kind of press on the knee and create imbalance between the femur and the tibia. You can go quite deep, but it really depends on the client. Some client would be really tender, and they would not be able to sustain that kind of work. Yeah. Around the, maybe let's, enough for now. Let's start and then I'll give you another, otherwise when I go to the end, it's like you don't remember the beginning. Okay? Should I remind you again? Yeah? Coming from here, this one, pressing, working on the QL, then coming from here, oscillation, then coming from this direction on the iliotibial, on the erectospinae, working on the back, this way, hip, upper hip, mid hip, and then iliotibial band. If you wanna start, you wanna swap clients or stay as you want, yeah?